sometimes when people have problems falling asleep, they think that staying in bed longer is going to help with that, right? So let's say you get in bed at 11 p.m. and you're unable to fall asleep until 1 a.m. and then you have to be up at about 7 a.m. And so you think, oh my goodness, I'm not getting enough sleep. Instead of going to bed at 11, maybe I should go to bed at 10 so that I can maybe fall asleep a little earlier at noon. I'm sorry, at midnight. So that is so wrong because that is going to make your insomnia worse, right? And understanding this is crucial. And that's why sometimes, having a sleep doctor evaluate you, figure out what is your natural sleep time, natural wake up time, and help you, with CBTI and all of that, figure out what needs to be your sleep prescription. Because when you go to bed earlier than your body is ready to do, or to, earlier than your body's circadian clock, you will still not be able to fall asleep. You're going to end up laying down there for more hours than you planned for, and you're going to start worrying and thinking, oh my goodness, I'm not going to fall asleep. And once you start, that whole cascade is just going to keep going on, and it's going to even make it more difficult for you to fall asleep. Sometimes you might even fall asleep later. So you have to understand your body's circadian rhythm when it comes to sleep and fit in that circadian rhythm. Because if you're naturally someone who is delayed, trying to fall asleep at 10, you're just hurting yourself because your body is not wired that way. Your body is wired to go to bed maybe somewhere around 12 or 1 a.m. And that's very common in adolescence. And so medication to fall asleep could help you, right? Because those medications make you drowsy and cause amnesia and, just help you settle down. But you are not taking care of the root problem. And so you could use that med 1 week, 2 weeks, you feel great. And then it gets to a month and it stops working. And you're like, oh my goodness, what's happening? Maybe it's time to go up on medication. And then you go up on medication and you feel great. And then it stops working. And then you're like, oops, I have to move to a second medication. And that is really why medications are not the first line for treating insomnia. And so many people term insomnia, the term insomnia is just thrown around a lot because it may not be insomnia. It could be delayed, sleep phase disorder. It could be anything really. And so, shift work, just name it. It could be all sorts of things. And so taking medication upon medication without really addressing what the root cause is not the best way to go. You do have to understand your circadian, your biological clock, and try to fit in that. If you understand your biological clock and you don't like it, you want to shift it, that's a different ballgame altogether. You talk about shifting your circadian rhythm with light and melatonin, used very differently anyways. But this is really crucial, guys. You have to get this right. You have to work with a sleep doctor who is going to help you fix your circadian time so you can fall asleep when you should be falling asleep without feeling like you're spending so much time in bed, without being able to fall asleep.